Welcome to Womb Talk. I'm your host, Elizabeth Vanderwalt, the owner and founder of Food for Womb Doula Services. In Womb Talk, we like to go over different topics that are acceptable for all audiences. We're not medical professionals, so everything on this podcast is just to educate you so that you can make better choices for your body. If you have a passion for all things women's health, then let's start listening. Today, I'm here with Jordan Searles. Did I pronounce that correctly?
Yes, nailed it.
The owner and founder of Muscle Mama Fitness. Welcome, Jordan. I'm glad you're here with us today. Would you like to tell us a bit about yourself and your business, please?
Sure. Thanks for having me. I'm so excited about this. My name is Jordan Searles, and I am a NASM certified personal trainer. And I decided to take that a step further and become prenatal and postpartum certified. So I can specifically work with women who are trying to get pregnant, who are pregnant, and who are postpartum as well, and really helping women learn to navigate the different struggles that there are with exercise and pregnancy, and then also how to navigate their recovery safely. There's a lot of myths that are still going around about pregnancy and working out as far and also with postpartum as well, so it's just a really tricky area of our lives that we still are kind of left with not a lot of guidance on. So that was really all of the motivation during my pregnancy and my postpartum experience, what motivated me to go get certified and start my own business about it.
That's really awesome. I mean, I agree with you. There are a lot of myths, and like I myself, I'm not trained in any of that, so it'll be a learning experience for me as well.
Mhm. Yeah,
Now, today we had mentioned that you had some FAQs that you normally get asked. So I thought I'd ask them in the podcast and then people can hear the answer without having to ask you again.
perfect.
So, if a woman has never worked out prior to pregnancy, should they still work out during their pregnancy?
Yes, that is one of the biggest questions that I get to is they definitely should. And just because you never worked out during pregnancy doesn't mean it's like, oh, I definitely shouldn't now. If anything, you definitely should. And it wouldn't be, let's dive in 5 days a week, maximal strength training. It's the same kind of process that you would if you were getting into working out regularly. You would slowly over time look to increase the amount of your sessions, whether that's weekly, whether that's maybe going for a longer walk than normal. So it's just a slow increase as opposed to just diving in head first. But exercise is so, so, so incredibly beneficial for both mom and baby that as long as there are really no other underlying health conditions, pretty much everyone should be exercising in some way, shape, or form during pregnancy.
And the exercises that they do, are there specific ones that are like the safest for pregnancy or the unsafest ones? Like, I'm sure there's a difference.
So that's kind of where the gray area kind of comes into play with pregnancy and working out because everyone has their own starting level. So there are people that are incredibly fit that get pregnant. And then there's people that are not so fit that are also going through their pregnancy and they're not going to be doing the same exercises, just again, based on their level of fitness going into pregnancy. As far as exercises that are deemed safe, unsafe, again, it does have something to do with fitness level. And then also, according to belly size, that's when you start to slightly modify exercises. It doesn't mean that they're dangerous. It's just this is what we need to do in order to make it just more appropriate for pregnancy. So the first one that people typically modify is any kind of twisting and rotational exercises where our hips and our shoulders are moving in opposite directions. So the biggest one is like Russian twists. We typically take those out in the first trimester, and then that is something that is pretty much eliminated throughout the whole entire pregnancy. And then basically as the trimesters progress and according to belly size and then also just general comfort level, that's when other exercises start to just be modified. The next kind of round to change up are the like jumping, running, explosive exercises. So typically around second trimester or so, that is when people start to dial it back. I know personally for me, I think my jumping days probably stopped around like 22 weeks. And then for me, everyone's different too. So there were actually three other women at the gym that I went to that were pregnant. We were all within a couple of weeks of each other. There were one of them stopped jumping sooner before me. Another one went up until about like 30 weeks and was jumping. And it's literally all again about like comfort and what feels good. And that is another thing that also motivated me to become certified is everything that I learned in my uh general certification for personal training. A lot of the guidance is like, hey, just listen to your body. And it's like, well, I'm pregnant for the first time ever in my whole life. Like, what am I listening for? Like, I don't know what it's trying to tell me. Like, no one told me about this. So that's another thing where I try to help, especially first time moms, is understanding the signs to kind of look for as to when to start kind of dialing it back.
And just off the top of my head here, because I'm kind of putting you on the spot, does
Yeah.
age play a little bit of a part in that as well? Because we are seeing a rise in mothers that are like over 35. Are you finding that for them, there's certain exercises that are better for them? Or, like you were mentioning, it's based off body as well. But
As
does
far as
age play a little bit?
As far as age, it would really just play a factor in the underlying other conditions that
Okay.
unfortunately do come with
Yeah.
waiting a little bit longer. So that those would be the only real reasons to keep an eye out for, like high blood pressure and weight and things like that. But as far as like specific exercises or anything like that, again, it all depends on the person's fitness level going into pregnancy.
Yeah, well, I kind of had the feeling that it was that way. I did have a client who she was like really good at fitness, and she did like a modified even spin class, like well into her pregnancy. So I was like, I thought it was interesting the more that she's like, oh, I'm still going to spin class. I think she went like the last week before she, had her baby. So I
Mhm.
was like, good for you.
That's incredible. Yeah. Yeah,
Uh,
for some women, they'll work out literally like the day that they go into labor, which is pretty funny. So, it's so different depending on a lot of different people.
well, I guess that really plays into the whole thing that there is no cookie cutter approach to anything. Like we could do these kind of topics, but we're like, hey, there's so many like the way you are compared to me and vice versa. Like there's so many different people
Yeah.
and styles in life, so it's
And even
definitely
within the pregnant, like even
yeah.
within one mom too, like her first pregnancy and second pregnancy might be completely polar opposites of each other and their
Yeah.
experience too.
Well, that's with the birth itself, right? They're always talking about like, oh, you can have the first, but by the third it might be a wild card, and they're like, it's different for every birth. So, I mean, it really is true.
Yeah.
And are there any exercises that you recommend that they can prepare their bodies for labor and for birth?
So there's definitely a lot of core work, which is something that I feel like is also a myth that when you get pregnant, it's like, oh, like no more core stuff because that's going to hurt the baby. Like I said, there's certain modifications that we need to make as far as like rotational exercises, and then as the trimesters progress, we start to elevate our hands with like planks and trying to take the load off of like the spine. So you could still do core work, except it just looks a little bit different. So instead of just not doing core work at all, definitely still incorporating core work into workouts. There are specific hip opening exercises that you can do. And then also, most moms can attest to this probably that the back pain is so real during pregnancy, right? So there are exercises that we can do to strengthen our back and our glutes as well, because we start to get pulled into that like tilted position basically with the big belly hanging out and a big arched back. So there are specific exercises to do to help with pain management during pregnancy as well as postpartum as well. So building a good foundation to help, breastfeeding moms as well, like getting out of that slumped position, back exercises, glute exercises, core exercises. Those are really the ones that you want to focus on during pregnancy to have also a stronger postpartum foundation. And then also those hip opening exercises that can help kind of not, I wouldn't say open the hips more, but just allow the hips to move a little more freely to allow baby to navigate down and hopefully make birth a little bit easier.
Well, that's very interesting. I mean, does are some of those exercises even beneficial for those that have babies that are like in the sunny side up position a little bit and where there's a little bit of that malpositioning with baby? Like would these
Oh
benefit
yeah.
that as well?
Yeah, definitely. And even some of those exercises, they could even maybe help baby kind of like engage into a better position as well. So some of these exercises, usually I start those like real like I don't like to call them birth prep exercises, but like they're just things that you can do before birth that just
Yeah.
help. Like I don't know, I got to think of a better word for them, but um there are exercises that I tend to push a little more on my clients if they're working with me up until their due date. I tend to do that around like the 30-week mark, and just to help again like opening up the pelvis and just allowing it to move a little more freely, because everything does get tight with a lot of the tension and a lot of the pressure. So navigating how to open it up and have it be a little more mobile is super important to also help hopefully baby engage into a little bit of a better position.
Wow. There's so many things that we need to do, eh? All the time. I
It's
tell people, I'm
crazy.
like, I've been doing this for like 5 years and I'm still learning stuff all the time. But I'm like, so before birth, they're like, here's 9 months, try to learn what you can. And that's where people like us come in handy, where we're like, yeah, you need someone else trying to help you through it because you can't study everything we've done in just a
Yeah.
short time. And
Exactly.
you were mentioning in when we were talking back and forth, you wanted to maybe possibly explain what is diastasis. I never say this correctly.
It's all good. There's so many different ways that people say it.
Yeah,
I just go like the I like the dictionary route. It's diastasis.
yeah.
That's
I've
just
been
the
trying
way
to
that
get
I
it
go.
out. Did you want to mention like what that is and how they could possibly prevent it?
Sure. So diastasis is the separation of the rectus abdominis muscles. So that is basically like our six pack muscles. So in order for a baby to grow, right, our belly stretches, everything it needs to stretch. So typically by the third trimester, pretty much almost 99% of women have diastasis, and it's not a bad thing. It's an absolutely normal part of birth and pregnancy and everything that comes with postpartum too. So typically, though, right around that 6 week or 8 week mark, when the doctor checks, that's when doctors should also be checking for diastasis. And the clinical evaluation of it is basically like two fingers or more, then that's the diagnosis of diastasis. If you have two fingers or maybe like one and a half fingers or less, that's not a clinical diagnosis of it. And basically, where the training and the core work during pregnancy, you really can't prevent it. It needs to happen in order for baby to grow. For postpartum, some women, again, everyone's different. Some women are very lucky and it heals, and they are, just through their daily movements, that's enough core stimulation for them to, um, they'd say, like close the gap. And it's really about getting that tension back again. So some women, they don't have it by the time they get their check and they're all good. There's other women that, have severe cases of like four fingers.
Okay.
But that doesn't mean that they're like that for life. There are exercises to do, and physical therapy as well plays a key role in this. And there are exercises to help kind of bring everything back together. And with that noted as well, the shift in diastasis right now is actually not so much as closing the gap, because those muscles will eventually close. It's really the tension, which is the transverse abdominis, which is your true deep core muscles. So that is what really gets stretched and ends up being like less than paper thin almost when, baby is max like 40 weeks. And then once baby is born, it is almost like it's almost like cellophane. Like it's super loose, super stretchy, but it does still have the potential to tighten back up. So that is the muscle really that you want to focus on for diastasis recovery.
Okay. And is there any way to make sure they're not making it worse?
So pretty much it's again really about pressure management and listening to one's body. One of the biggest things to keep an eye out for in both pregnancy and postpartum, it's called coning or doming. So basically, it's all about pressure. So if we hold our breath and we start to push out, you'll see it's almost like a bulge literally in your belly, and it's the pressure of the air being forced out because our diaphragm, our pelvic floor, and our core all work together. So when that happens, there's like a little lump in the middle of your belly, and that just means that whatever exercise you're doing or however you are managing your breath is just too much for your body to handle right now. So breath and pressure tend to push towards the weakest part of that system. So, whether that's down into the pelvic floor, whether that's out through our core, or if we are managing it right, it's coming out properly through our breath. So, managing that will also help not prevent diastasis, but hopefully not make it as worse.
Wow, there's really so much to it, eh?
Yeah.
Like, "Oh, yeah, I'm having a belly," and then, "Oh, there's a belly on top of the belly, just so you know."
Mhm. Yeah, it's really crazy that a lot of it is how connected really everything is, and you hear it a lot, but then when you actually learn about it and go through it, it's like wow, like everything is connected.
Yeah. And is this common in women? Like, is it, like, in 1 in 4 or, like, everyone has it? Like, is there a percentage to it almost?
Diastasis, I want to say they say about like 60 to 70% will have some degree of it or
Variation of it.
so. Yeah, yeah. So whether I mean me personally, like I had 3 fingers or so, like 3 fingers, two and a half. And then, like I said, there's like more. There's worst cases of like 4 fingers, 5 fingers or so. Like that one's pretty severe. Usually, I mean, sometimes with like twins, it can get pretty bad. But again, it's all natural. That is a part of childbearing, and it's not irreversible.
Well, I mean, that's a good thing. We want it to be reversible somewhere down the line.
Yeah, yeah.
And just to change gears a little bit, what about the postpartum period? Like, what about when can they work out after having a baby?
So that is one of the another big question that I always get is like, so many moms are like, when can I work out again? And it's like, okay, that's great, but you need to go slow, right? Like I always use the reference of it took you 9 months to make a baby and your body to change. It's gonna take a little bit of time to go back to what you normally did. So typically within those first 4 to 6 weeks, it's really all about just healing
Yeah.
and keeping mobility and trying not to get stiff because a lot people preach and I preach like rest, like you definitely should be resting. Your body just went through what I call is a PR of a lifetime, a personal record, personal best of an absolute lifetime. Your body definitely deserves the rest. However, there are like mobility exercises and little small things that you can start to reconnect with, which will help build a good foundation for the postpartum recovery period. So, working on breath work again, reconnecting your breath to the core, to the pelvic floor, and then as well as mobility for upper back, lower back, and hips again. So, as far as exercise, again, it's all about what you view as exercise. So during that time, like maybe you do a couple of stretches, you do a couple of breath work exercises, and like that's your exercise. As far as jumping back into, a full blown workout routine, typically again that like even the 6 to 8 week appointment for doctors that they say, oh, you're cleared for exercise. And it's like, well, should I go back headfirst into what I was doing before pregnancy? Like, absolutely not. So, again, it's all about how the person is feeling. Also, their type of delivery makes a huge impact on it. Was it a long labor? Was there a lot of pushing? Was it a C-section? Was there any kind of medical interventions? So there's a lot of other things that even though the doctor might clear you for exercise, it doesn't mean you're actually ready for exercise. It's just the doctor is literally saying, "Hey, your insides seem like they've healed.
Yeah.
It doesn't mean you're ready. It's just like, hey, things are good.
And you were mentioning their C-section a little bit because I was kind of in my pondering a little bit too. Do you think that they need to wait longer after a C-section? Like maybe instead of 6, it should be 12 weeks, or just like in your opinion of what you've seen a little.
hmm I mean, honestly, I think both of them should be longer. Like both of
Okay.
like the actual clearance for exercise, because I think it unfortunately sets a lot of moms up for failure and also puts them in a spot where they think they can go back to their high intensity, cardio training or jumping and running and all of these things. And then they, have either like incontinence or, bleeding happens sometimes. Like it kind of sets moms up for failure, unfortunately. So I don't, maybe at least like 10 weeks, I'd say, of like, okay, like now you can kind of start to play around with a little bit of more intense exercise, like the moderate. But that 6 week, I still believe is just way, way too soon.
Yeah, well, there's a lot of in different cultures they have it too. Like the fourth trimester is actually more like a whole 3 months plus, right? So
Yes,
6 weeks isn't that long at all. And
it's
our
crazy.
our our Western culture is definitely very hooked on that. Like, oh, 6 weeks, go do things again. It's
Yeah,
all
go back to
normal.
work.
It's
Yeah.
it's definitely kind of insanity.
I agree.
And I think you touched a little bit on the exercises, but is there one that like stands out to you that that's what you start with? Like maybe even just taking a 30-minute walk, or like what's the first one they should be trying just a little bit to bring
So
in?
it would definitely be it's definitely the breath work. It's one thing that I was a little bit oblivious to, I guess, in my pregnancy and didn't really understand the importance of it until you going through it and realizing that when I went to pelvic floor physical therapy when I started about 4 months postpartum, um, the PT had said, she just like said, sit, I'm going to watch you breathe for a second. I'm like, what do you mean? So then I start breathing and she goes, okay, like we need to reteach your body how to breathe basically. And I'm like, what do you mean? Like I'm just breathing. So thinking about it now is obviously when a baby grows in your belly, it pushes everything all over the place. So pregnant women tend to start breathing with their chest and their necks as opposed to full rib cage and full belly breaths because baby's in the way. And if you start breathing like that for, 5 months plus, that's the way your body tends to stick with breathing. And that's something that needs to get changed back to again, rib cage engaging the lats and belly all expanding as one and all contracting as one. And again, coordinating the core and the pelvic floor with that breath as well. So that's definitely the first thing that I always tell a lot of my clients to start with, especially postpartum, and something that I definitely plan on like probably day 3 or 4 coming home from the hospital is just like very, very gentle, just remembering how everything works together.
Wow. I mean, I know how the body has changed and everything, but to think that your brain like just remembers a whole new pattern of breathing, even though you've done it your whole life before, like, hey, you know what? I've lived like 20 plus years, but like, let's be honest, let's just breathe the whole different way now after only 5 months. Just stick
Mhm.
with that.
It's so crazy.
Those little babies, they're so much fun, but like they're the mess and everything.
I know. I know. All the little things that moms get to deal with.
I know, and it's so elaborate. Like for me, like I take care of most of the emotional, like the physical side as a doula, like just to help that way through the birth or through the postpartum. But then to think, oh, yep, I need someone to help relearn breath work and like get slowly back this piece, and oh, this piece needs someone. Like it's where that whole village statement does come back really, because
Oh, yeah.
it's yeah, we can't just do it alone. Like I can't just remember how to breathe differently and like you're just having a newborn. You're not going to be thinking, "Yep, what I got to be worrying about is my breath." I didn't think about that.
Exactly, and that's another spot where, like, pelvic floor physical therapy and a personal trainer can really help come in and also just help remind
Yeah.
moms how to do things, and it's even just, hey, if you have literally 5 minutes in the morning, just reconnect. And a lot of the clients that I've worked with too have found that there's even just like the mental benefits of it. It's just like I get to just sit in peace for 5 minutes and just work on my breath, and I'm actually like finding myself like a little bit calmer throughout the day. I'm like, this is perfect.
Yeah, so it's kind of even not just like a physical thing there you're helping with, it's more of the mental too, that,
Yeah,
it can be kind of a big aspect after postpartum, especially.
exactly.
And do you recommend any type of books or video classes like to do this kind of stuff at home a little bit? Because sometimes I'm more of a homebody than I am going out kind of thing. So I'm always like, I'm on the side of people may want to do this at home. So, like, what should they be looking for?
Yeah, definitely. So as far as books go, I have yet to kind of stumble upon like an exercise book for pregnancy, really. I did find it's called Real Food for Pregnancy by Lily Nichols. This is all about the nutritional side of pregnancy, which is really, it's really interesting if you're into really the nitty gritty of like nutrition. So like macronutrients, micronutrients, and understanding all of their individual roles in building a baby and building of the placenta, and like it's really interesting. So if you're kind of like a nerd for nutrition about that, that's definitely a great book. She also did do a very good book for I believe it's also called Real Food for Fertility as well. So that's the nutritional side of it. As far as any kind of exercise recommendations, if you are in the Robbinsville, Hamilton, Princeton kind of area, there's a woman that I went to one of her classes. Her name is called Brittany Thatcher, and she does motherhood and movement. This is more for like postpartum, but she does yoga classes, and you can bring your baby to the class and just like have your baby with you while you do like some gentle movements and stuff. So it's a really good time. And she did one at like the Princeton Play Space, and I brought my son. He was about, I think, like 14 or 13 months when I brought him, and he was just running around the whole time. And everyone has their kids just like running around, so it's just like this mutual understanding of there's chaos, but we're still going to have a good time doing yoga. But she offers classes for even younger. So, like, I think the youngest she does is like 18 weeks, and then 18 weeks to like a year. She keeps like the kids that like aren't running around together, and then the kids that like are running around in a separate class.
People get your corners.
Yeah, yeah. The other one too that some of my clients have looked at as well, and it's called Strong Like a Mother app. Um, she does some really good diastasis help, and some core exercises. And again, it's a good foundation to build, but that's where a personal trainer can really come in handy, whereas like apps are kind of generalized, and it's good for like the general public. But if you really want something that's really specific to you and your needs, and then also the time that you have, that is where like a personal trainer can really help come in and help you navigate how to get back into exercising during postpartum, because it's really tough.
It's a lot of steps to it, really. Unfortunately, there's way too
Yeah,
many.
yeah.
Uh, but I mean, like, to side sweep back to that Lily Nichols, she actually has one for gestational diabetes as well.
Yes,
Have you
yeah,
have you read that one?
yeah,
Yeah.
yep.
In my earlier years of this podcast, I actually had the opportunity to interview her for the podcast.
Really? Oh,
Yes,
that's
it was really
awesome.
awesome to meet
I'll
her.
have to scroll
Like,
back, yeah.
but it was definitely like it was in the earlier stage. I'm sure if she looked now, she's like, "Oh, you're little yet." I'm now a bit more out. I'm sure she'd be like, "No, no, no." But it was definitely very interesting to like talk to her about that kind of stuff as well. And you had
Yeah,
mentioned it. I was like, "Oh yeah, those are really helpful books." I still have yet to read a fertility one. Have
yeah,
you read it
yeah.
yourself?
I started it, and
Yeah.
it's the same level of intrigue and intricacies between and like a really good understanding with studies and everything. So it's the high standard of the nutrition for pregnancy, basically.
Oh, it's just amazing the stuff that they have out there and
Oh
what
yeah,
like
and what they
if
don't have out there.
yes, exactly. I was literally I was making my social media post yesterday. I was like, you know what? We don't talk enough about the fact that like women have not really been included in medical studies and tests for a long time, and we're still clueless. Like to this day, we don't know about stuff.
Yeah,
And
and it's like, oh yeah, the recommended like amount of protein for women. It's like, but there were men in the trial and there weren't even any pregnant women in the trial. Like, how does this make sense?
I always tell at home I'm always saying like I don't think people in this world should be bored. I think we need to like just start studying things more. Like more studies need to be done and more people need to be like asking the big questions and that's why I think it's like women like you and like myself and other women that are out there trying to find more answers for other women, which is kind
Yeah,
of definitely needed in today's day and age.
a
which
hundred
is
percent.
which is hard to say because we're in 2024. You would think we're all so advanced. But that's
It's
completely sidesweeping our conversation here.
yeah, it's all good.
Is there anything that you feel like is the biggest thing that we're not being talked about today for pregnancy, for postpartum when it comes to exercise? I know we touched a little bit on like the fact that, we're going way too quickly after postpartum, but is there anything just like at the top of your head that you're like, man, women do not know this. Women need to know this when it comes to exercise and all things that.
I mean, personally, I still feel like we're still in a little bit of the fight of having that fear of strength training. Even if you're not pregnant, strength training is really, really beneficial for all women. Either if you're not pregnant, if you're thinking about being pregnant, if you are pregnant, if you're postpartum, and even, during menopause, just literally in all stages of a woman's life, like strength training should be a part of it. Not only are you preparing for your body to be able to handle, an extra 25 to potentially 45 pounds on your body when you do get pregnant, then you also have to, carry that roughly 7 to potentially 10-pound baby in a carrier when you're postpartum, when the doctor says you're not supposed to pick up anything over 20 pounds. And then keep up with that growing baby. And then maybe you have a second one, and now you're keeping up with two growing children. And it's a very, very physically demanding lifestyle. And a lot of women, complain of back pain and shoulder pain and all of these small little pains that probably could have been either prevented or just not as prevalent in their life and not as controlling in their life if they had just strength trained during the specific parts of their life leading up to that point. So I still am fighting the fight that, it's strong is the new sexy, basically, that, if it's bulking and all of this, lifting weights will make you look like a man. I'm fighting against it that it's supposed to be, lifting weights is for parenthood. That's going to make you a better parent. It's going to make you happier. And again, that full circle of like you feel good, you feel confident, and you're going to be a better parent that way too.
So you think maybe even people should be doing this before they get pregnant, trying to strength train. Like those who are trying to get pregnant should be get on there, try to do some strength training at the same time.
Oh yeah, definitely. Because think about it too. Like if your body's not able to carry around a little extra mass, pregnancy is going to be really it's going to be really difficult on your body. You're gaining a decent amount of weight in a relatively shorter period of time,
Yeah.
and if your body's not used to carrying that weight or at least the demands of that, then it's going to be a harder pregnancy for people.
So many steps. I know I've said that a few times today, but I'm
Yeah,
like, oh my.
yeah.
That's just a crazy thing about this all. But how do people find you? How do people work with you? Do you do virtual services? Are you in person? And where are you at? I mean, I don't need your
Yeah.
pin location, but
Yeah. Yeah. Yeah, so mainly a lot of my content and everything is on Instagram. It's at Jordan SRLS underscore fit. And I do have a working in progress website, but I'm not gonna completely throw it out there yet. But so it's really Instagram's the biggest way to find me, and then also my email address is a good place as well. It's fitness.musclemama@gmail.com.
Awesome. And you're going to probably send that stuff to me my way so that I can put it in the bio and everyone could just quickly click down there and send you off your emails and boom, like that.
Yeah, yeah,
And do
that would
you
be
offer
awesome.
in person classes or in person support at all either?
Oh, yes. So, right now I am only doing online, and personally, I think that that's actually perfect for especially a lot of the postpartum moms because trying to add more onto their plate to try to get out of the house, it's completely on their time. If they can do the workout at 6 o'clock in the morning, that's great. If they can do it at 7 o'clock at night, then that works better for them, and then it might look different the next day. So online training is definitely the route that I'm pushing right now. However, in the future, I am looking to potentially take some in-person clients. Our home gym, which is our garage right now, is currently being finished. So we want to put in actual walls and we want to have heating and air conditioning. So once that gets all updated, then I am definitely going to look to take on some in-person clients too.
That is going to be awesome. So if anyone's listening in like 6 months from when this is posted, look her up. She might be
Yeah.
posting about it then.
Yeah, definitely. That's the goal. Hopefully soon. Hopefully within the next year or so.
Time though. Things always go like this. So you're like wanting it and then it goes like really long, but then when like you don't want time to go fast, boom, it's gone.
I know. Yeah. It's so crazy.
Ah, now, to close it off, do you have like a favorite quote or a final tip? I know I already asked you about a tip, but like anything that you want just women to know in general, regardless of age, like that you just want to say out there.
Um, wow.
I put you on the spot.
I know this was one that was there's so many that come to mind, especially for just reflecting on like my own journey. But I guess that's really what it is it's your pregnancy and postpartum journey is strictly your own, and don't compare yourself to anyone else. That it is your own journey. And I always said it to myself, is this is my mountain so that I can show people how it can be moved. That this is strictly my own path. That try not to compare yourself to others. Don't try to compare yourself to society's expectations of things, and don't put pressure on yourself.
Easier said than done.
Exactly.
Because
That's why it's constantly in my head.
yeah, like let's put memos right everywhere. Like I'm such a memo girl. Like you'll have, oh, do this quote right there. And that is definitely one you got to remember because it's very easy to compare yourself right now. And especially like in the postpartum when you are a bit more sensitive about everything, you
Mm.
are like, oh, this person is doing such a better job than me, or, such and such.
Yeah,
And
especially when you have friends that gave birth around the same time and you're all still very close, but it's so hard not to compare. And
yeah,
everyone does it, but it's just really like put the blinders on, like be happy for them or, whatever you need, but remember you're your own.
those blinders, I think that would be a really nice built in feature of us.
Yeah.
Oh, well, I'm so glad you
Yeah.
came today and then we had this discussion and like we
Yeah.
taught people so much. You taught me so much. Like I didn't know half of this
Thanks.
stuff.
Yeah. I'm so
And
happy to be here. And that's the main goal of everything is just try to be the resource that I wish I had through my pregnancy and postpartum, and really just have someone that I could really connect to and rely on for helping you through that journey.
well, it's very good that the world is getting you to help us because I'm sure a lot of people need this. And if it's online worldwide, people can get you and work
Perfect.
with you. So it's definitely awesome.
I'm looking forward to it.
Yeah. Okay. I'm so glad you came. Thank you very much. And I'm
Yeah.
sure you'll be back with more. I feel like there's a lot of topics that still yet to be discovered.
Oh, I would love to. That would be so awesome.